So good afternoon, everybody. My name is Dean Skillicorn. I am the Imaging Services Manager for St. Luke's Health System in Boise, Idaho. So I work in the Health Technology Management Department there. We are part of our organization's Integrated Health Technologies Division, which is basically our IT and software divisions and then HTM. So we all work collaboratively together to ensure that whatever services or issues we're having with our software or our medical devices, we all work together to resolve all of those issues. I also double as the capital equipment planner for health technology management. And then I am the resource for all AAMI standards for medical device management. So I sit on all the AAMI committees for the medical equipment management committee with AAMI. And so I have access to all the standards and how to comply with them. Let's see. This presentation is all about contracting and vendor management and understanding contract philosophy. So I'm going to ask, are there any vendors in this room? Everybody works for their own organization? Okay. So the agenda is going to be about contracts, analyzing the data to support your decisions financially and clinically. That's the most important part. Finance is great, but if you can't support your decisions clinically, it doesn't make sense financially. Managing and assessing agreement performance, the devil's in the details. This is all about getting the data from the OEM and comparing it with your own data. Negotiating contracts is about teamwork. You can't do it individually. You need your supply chain management people. You need the users. You need your technicians, and then your management structure. Establishing KPIs, be SMART. SMART acronym is something I'm sure everybody understands. Be specific, okay? Managing OEMs and vendors, hold them accountable to your standards of care, not theirs. Point of sale service agreements, is this an option? And then managing fleet technology, volume creates leverage. And finally, make rights. When all else fails with a vendor, what's the make right? And that's about putting pressure on them. So understanding contracts, analyzing the data to support your decisions financially and clinically. So you need to be asking yourself some really specific questions here. So how do service vendors set agreement pricing in their own budgets? Does anybody tell me what the answer to that is? Do you understand the question? Go ahead.
Well, I mean, in my experience, the vendors basing their loss from very large.
Yeah. That's correct. Yes. So, but when we look at writing equipment specifically for a customer, okay, what is it the agreement is doing for them? Okay, so how much profitability do you think is in a service agreement? What's a lot? Anybody else? Okay, anybody else? If I told you their contribution margin rates, which is their profitability, were in the 70% range, would you believe me? Folks, I worked for Philips Healthcare, and I managed their largest multi-vendor contract on the West Coast at LA County Department of Health Services. And I had to annually measure my profitability on my contract, and it astonished me. The internal profit on that contract was between 65 and 70% of the price of the agreement. And that agreement was 8 million. They were making $5.6 million a year. Okay. They have everything buried in these contracts that is unreal. Your clinical education, remote monitoring stuff. So when you're looking at a contract, you want to take a look at the specific language. And I mean, you need to get in detail and understand what is covered in your contract. What is the most appropriate data needed to initiate this process is what? Service history from the vendor, comparing it against your service history that you have on records in your either your CMMS or manual records. Okay. Make sure the vendor is doing what they say they're doing and it matches your records. And then compare what is your time and materials cost to the actual cost of your service agreement, and you will find some very astonishing numbers. Yep. You mean it's under warranty? Okay, we're going to talk about point of sale contracts here in a little bit. Okay. What does the service vendor's data show to evaluate contract points, and what are the variables in between them? Okay. Understand your cost of doing business. Determine the volume of labor and parts a vendor is anticipating to spend with your equipment. Be an agreement versus hourly billed service. So you take their list of services from their previous year and take a look at how much labor they spent, how much in parts that you spent. Okay. Because you can figure that stuff out. The number of labor hours and travel hours is billable rates. They should have to, you just use their posted rates, you figure that out versus the cost of your service agreement, and you're going to find out some interesting numbers. And you track those numbers. It's not that you want to necessarily take money away from them, but is there opportunity for you to leverage them to reduce those rates? Okay. Let's see. Determine hours of service. Are value added services impacting the worth of the delivered service? So user education, remote service support, technical support. If you have MRs, helium fills. Okay. Helium fills today on MRs are enormous. They're in the $50,000 to $70,000 range. So that's a crazy price. And you just compile all the data into dashboards by modality. Okay. And you measure. And the key to all of this, okay, is eventually you want to compare this against your hours of operation in the organization and what are the key operating hours that you have. Can you change your services, your service times with the vendor and renegotiate to try to get a better effective return on your revenue so you can avoid some loss of revenue? Analyzing the data, just understand the complexity and the details of all your service agreements. Look for the hidden issues. User education is included in the contract for the users up to 8 hours per individual, okay, over a span of time. Well, if it's just one individual, what's the value to you? If you have 16 hours, how many people? So understand what you're getting in the service agreement. Understand all the vendor service pricing, full coverage, PM only, parts only, or for in-house organizations, service keys cost. You know, some vendors offer in-house support agreements like Philips and Siemens and GE do, okay? Understand what those costs are. Understand what their training costs are if you have an in-house department. So you can sit here and figure out, I want to plot and do all these things. When St. Luke's hired me, they had 5 people. I lost 2 people walking in the door, one to retirement, one to a family issue. So for first 2.5 years, I worked with 3 service technicians We just hired 2 or 4 more in the last 2 years. We're at 7 and I still need more. So this data can not only help you understand what your vendor's doing, but when they supply it to you, gives you the chance to see what your cost to support your equipment is, okay, or could be. Use your legal department to influence agreement language and language that can be changed. Determine how and when to hold service vendor performance review meetings. How many of you hold business reviews with your vendors? How often do you hold them? Quarterly? Every vendor? Even the small ones? Okay.
Pretty much one big boy, but we do it monthly.
Wow, that's okay. Anybody else? We do them depending upon the size of the vendor. So if we don't have a lot of service volume, we'll push a vendor out for an annual. But our big vendors like Siemens and Philips, when we have a lot of volume of business with, we're doing those on a quarterly basis at a minimum. And if we have performance problems, we also set up service review meetings in addition to our quarterly business meetings. So we make sure that we're not running into service related issues, which is the biggest part of our contracts we found out. The delivery of services. The OEMs finding out, oh, gee, I was late on your PMs and I didn't really mean to be. Or, gee, I'm supposed to be there in 4 hours, but for the last 3 months, I haven't been able to make the 4-hour response time. Most of them have cut their staffing back due to retirements, and so they don't have the number of people to cover their services. Let's see, managing and assessing agreements. The devil is in the details. Again, set meeting cadence that meet the volume of business with the vendor annually at a minimum. Structure meetings primarily around performance. So what we do with our meetings with our business is we let the vendor present their data first, and then we get into the heavy discussions. And I mean, we spend in our business review hours a minimum of 4 to 6 hours with the vendor when we're doing these things. So make sure that you spend the time to understand what the meeting is going to be about and plan for it. Let's see, does your data align with the vendors? So what you do is to prepare is you ask them to supply you the data up front before the meeting. So it's going to be about the quarter that was previous, not the quarter that you're in, okay? Compared to your established KPIs, how many of you set key performance indicators for your vendors? What kind of indicators are you guys using? Yeah, I add additional KPIs, okay? Because I'm tracking their turnaround time, their time to be on site, their ability to deliver parts in a timely manner, and if those parts issues are causing delays in service that are costing my organization. So I'll give you an example. I hate to beat up on them. Siemens and their relationship with DHL and FedEx out of Memphis. Memphis has the highest rate of thunderstorms in any port that vendors use to ship out of parts. That includes New York, New Jersey, Washington, D.C. They all funnel into to Memphis for most of the vendors, for Siemens, GE, and Philips, okay? And then they push them out to the West Coast. So if you're on the West Coast, you got a problem. They get thunderstorms or snowstorms or ice storms in Memphis, you're done. And that's most of the time. And I'm seeing a lot of parts deliveries getting delayed, which are causing us additional downtime. We're remote in Boise. I have asked the vendors to store parts locally, and they refuse to do it because they don't want the overhead. So when their contracts come up next time, we have a new warehouse, and we're going to tell them You're going to store parts in this warehouse. You want to come and get them for other people, that's fine. But you're going to store them. They gave us written agreement to do so, so we're going to hold their feet to the fire. What tools do you use in your assessment? And by tools, I mean, you know, are you using just service report management? Are you using a computerized maintenance management system to track your costs? Spreadsheets, data from your finance department, okay? I know some purely imaging organizations and like standalone imaging outfits, they have a person dedicated to taking every service report, and they take all that information off the service report and they put it into a spreadsheet. That's great. Or even Access. I used to use Access when I first started in my career. How do you monitor vendor performance? People ask me this a lot, and I'm like, I cross my fingers and I hope that they meet the standards that we set in the agreement. This is a physical thing. You have to keep track of when you open service calls, when they respond. Most service agreements have written in their standards 1 hour of telephone response. Okay. Then after they agree to a time to be in, it has to be within 4 hours of the telephone response. So really they got 5 hours to respond to you. I can't get Siemens in the door within 4 hours at my location anymore. Used to be able to, but they've had 2 retirements in the last 2 years and they haven't hired anybody. Okay. So make sure that if you have performance stuff guaranteed in your contract for parts delivery, for on-site support and telephone response, okay, turnaround, make sure you're measuring those things and hold them to those measures, because otherwise they'll just do whatever they want and it'll affect your operations. Finally, who within your organization helps evaluate the vendor's effectiveness? Every organization I've ever been in has been different. I've been doing this for 30 years, and every place is different. It's up to you and your organization. Mainly the people who will hold the vendor responsible for their effectiveness is your supply chain management or your legal departments, one of the two. Who's measuring and evaluating it depends on the size of your organization, okay? But make sure you know so you can get with those people and talk to them about escalating service issues. Because if you don't escalate service issues with them, the vendor's just going to go, well, you never brought this to our attention in the first place. I talk to my Siemens service manager and my Philips service manager weekly. And it may be I don't have anything to say that needs to be addressed, but I make sure I talk to them weekly so that they understand I'm watching. Okay. Negotiating contracts. Oh, that's great. I got to learn to spell. It's about teamwork. So leverage the data to support your needs. What does that mean? Well, sure, it's not going to support the vendor's needs. It's got to support your needs and your organization's needs. Service delivery. Are there services impacting prime hours of care? So take a look at your service delivery hours and take a look at your service reports and see how many times in the day your service calls are within contract hours and how many of them are outside of contract hours. When I first came to St. Luke's 4 years ago, the first thing out of the directors' mouths were, how do you feel about expending overtime? Well, how much revenue are you costing yourself? And that was the answer that they wanted to know. Because for MR and CT, nuclear medicine, cath labs and IRs, they're the biggest dollar makers for a hospital system. They don't make money off of patient care and the patient monitoring areas, they have to have those areas to treat. But imaging is the biggest money maker for the organization. Okay, make sure that your services aren't affecting the ability for normal hours service for regular services, not for down system. I'm talking about, well, you know, I broke the latch on this thing and it's not a big deal, but you know, you guys still need to come in and fix it. Make sure that those types of services aren't taking them down during their busiest time. I found out my organization's busiest time were from 10 o'clock in the morning until 10 o'clock at night. And I went, now that's not normal from what I've seen, because when I was in Los Angeles, it was from 6 o'clock at night to 6 o'clock in the morning. So it depends on what you're seeing, and you need to analyze that data to make sure you're not impacting their services. Siemens came to me earlier last year, early last year, with their new offering, which is called CentraCare. Okay, CentraCare is all about blocking Siemens from being in your hospital for certain hours in your primary care hours, as they call them. Okay, the time that you use the equipment the most. And I went, why would I want to pay you for this? I can design this service myself internally with service level agreements. And we can make our own decisions, and we're going to come to you and ask you to do these labor hours. And they wouldn't do it. So we stayed with standard agreements. And I pay the overtime. And it's still cheaper than doing what they wanted me to do for MR. They wanted to raise my costs on our 11 MRs by between $700,000 and $850,000. Okay. Why? Well, Dean, you got to understand that when we negotiated these agreements originally 8 years ago, that, you know, you guys didn't get a bump. I said, oh, that's not my fault. That's your fault for not negotiating better. I said, but I have a budget and I'm not raising that amount of money. Go back to the drawing board, and they refused to do it. So we just stayed with what we had, and it was still cheaper than what they offered. So you got to be able to, when they come in the door with these new programs, they're so heavily incentivized to sell these things that they push everything else out the door. And this is the only way we can do business. No, it's not. No, it's not. Don't ever let a vendor tell you it's the only way that they can do business, because it's not. It's the only way they want to do business. Okay. Understand the vendor's pricing methodologies. It's different for each vendor and each modality. Be careful of the modality situation, especially around CT and around MRIs. Don't forget, with MRIs, you have to have chillers and you have to have helium refills available. Because you don't want, if you're having MRs under contract, you don't want the helium fills to be billable. That's a big event. Okay, so understand everything that can be done in your way. Make sure that they list base coverages, okay, and line item key options at list price for you first. Siemens won't share their list price with you. They'll give you what the discount rate is until you figure it out backwards, which is okay, but they should be listing what the list price is. Philips and GE will tell you what the list price are, and then they will give you an associated discount. We'll make sure you understand the discounting. If Siemens says they won't do it, ask them what's the discounting price. They have to disclose discounting. That's a law, because they are able to write off the discount on their taxes. So they have to disclose the discounting rate. Yeah. That's technology management. That's not contracting, but I understand your comments. Yeah, with MRs, don't forget about having your chillers maintained. Whether it's through your building services department, a contractor, or you train your own people to do the chillers, it's especially with MRs, you gotta have the chillers functioning, especially being here in Florida or Arizona or even where I live during the summer where temperatures can get 100. We went through 110 degrees last year and I was scared my chillers were gonna fail, but I never had a failure because I kept them maintained. And then I made our vendor go in daily to make sure that we did not have dust and debris on our chillers.
One spontaneous punch a year. Now, people think that's stupid because they're almost.
Oh, one spontaneous.
One spontaneous punch per year per contract year.
That is not a bad idea, but MRs don't quench a lot, but it's not a bad idea. Oh, you had a spontaneous quench. See, let me guess. Phillips.
No, it was Siemens.
Really? On what, an Era?
It was on a pre-T.
Oh, on the Skyra. Oh, wow. I've never seen a Skyra quench. Now, when I was at Phillips, the Achieva, if you whispered in the wrong direction, those things would quench.
So when I looked at their new service contract, I told them I want
That's,
spontaneous punch a year.
it's going to be at an additional cost, but what you do in contracting it on the back end, did you pool them together and say one for the total system or one for each unit? One for the, there, that is not a bad idea, to be quite. If you have a lot of MRs, you have 2 MRs, and so, okay, so you, for both of them, that you could have one quench between the 2 per year.
Between the 2 per year.
There you go, somebody thinking outside the box. How much does that cost me versus what is it going to cost me for the quench? Can anybody tell me how much a quench is? No.
It cost me $122,000.
Thank you. Yes, a quench requires that they come in and they have to ramp the magnet down. That is a $40,000 expense when you walk in the door. And it includes the return of it back up, okay? But then you have to pay for the helium refill on top of that. And depending on the price of helium at the time, can make it 100 to 100. I saw one quench one time at $150,000. Hitachi. Yeah. Well, the first quench I ever experienced was when I was with Phillips. I was a multi-vendor manager at a hospital system in Southern California. So they got stupid, and one of the RTs came in with a Ferris tank, and they had a kid on the table, and the tank missed this kid's head by about that much, and they, thank God, didn't bust the neck on it, but the gauge and the neck hit the side of the MR and stayed in place without breaking it off the helium tank. Because if it had broken that helium tank or that oxygen tank in that environment, it would have been a fireball. And I took pictures of that and I went to the CEO of the hospital. He was like, we put the pictures up on a management meeting and said, no more. We ended up getting metal detectors, Ferris metal detectors before they could. Oh, but it's the funny thing, we got that system back up and running and it quenched on its own 2 weeks later. So we got hit with over $200,000 of downgrading or deramping the system and quench fill or helium fills. $200,000 for 2 quenches. problematic, then you have a bad magnet. Magnet's destabilized at that time. Something's wrong with the hysteresis field in the magnet, and it's not able to hold its properties correctly. So define or refine to build master service agreements with terms and conditions if possible. They're going to give you terms and conditions in their contract, and I typically take them and throw them in the garbage and tell legal, we write our own terms and agreements. If you can write your own terms and agreements, it's best. Coterminous dates for all devices. Folks, about fleet, we're going to talk about, it's about fleet management. Okay, one renewal date, make it a master service agreement. Okay, one invoice, know your leverage positions and negotiate from a position of power. You are the customer, you're the owner of this device. Why is the OEM telling you how it's going to be? You're the customer. Would you tolerate that from your car dealer? Servicing your car? No. I can take my car anywhere, right? Well, you have other sources. If you're not happy with your vendor, call a third party. See what they can do for you. Establishing KPRs, be smart, specific, measurable, attainable, realistic, and time bound. Does that ever sound familiar in anybody in management? Okay, make sure your vendors are built and their margins are around their margins and metrics. Okay, specifically around their margins. They're in business to make money. Does everybody here understand what EBITDA means? So if we're making 1 to 3%, how come they get to make 28%? Because we're not smart enough to tell them, you make all this money. When I was at Philips, I discovered all of this stuff and I went, holy smokes. I was a former in-house manager, and I went to Philips because I wanted to learn about the manufacturers, and I got a lesson, folks. It was amazing to me, some of the things we did that scared the living blazes out of me. Okay, involve your clinical customers in the decision when contracting. Bring them to the table. You're going to discover that they have all kinds of issues that the vendor's not resolving. Okay, what are their effects to their operations and their reimbursements? Make sure you understand your service dollar cost versus their reimbursements, especially in imaging. Involve supply chain management, getting specific, okay, smart. Our vendors' manpower quantities and levels guaranteed to meet your needs. So ask them, what's your staffing? We want a list of your people that are coming into our hospital. It's all about vendor management there. How many of you have kiosks where vendors are supposed to sign in? VA does. I know that answer already. Huh? Yep. Okay. Well, there's things that those companies that manage those kiosks make the vendor comply with. Healthcare issues, the testing for TB and things like that, okay? But their qualifications to do their job, performance of their employees. Did they pass or are they on a PIP? Okay? You have the right to know those things at a certain level, okay? Because when I was at the county, they had a hell of a vendor qualification process that we had to go through, and I had to annually validate everybody's performance, whether they passed a review process or not. Point of sale, somebody brought up point of sale agreements. Who was it? It was you, wasn't it? Okay, so a point of sale service agreement is an agreement that is made at the time of purchase. I don't know if the VA does point of sale service agreements or not. Yeah.
Yes.
You'll look at service agreements after the warranty period is expired and negotiate, because the Department of Defense helps you guys negotiate your purchase agreements. Okay. She's lucky. She gets to work with the military, and they're hell on angels, wheels at negotiating purchases. Okay. So why are they popular? Well, they have this enticement. It's called a hook. And that hook is 3% capital reduction. And supply chain jumps at the 3%. Well, if we can sign this service agreement, we get 3%. What they forget on the back end is, what is the discount on the service agreement? Guess what? Typically, if you don't ask for a discount at the time of purchase, it's 0. I found a vendor that did this, and we were guaranteed 35 to 40% by our national purchasing agency. They never applied it to our contracts. We lost out on $6 million in savings for a large contract.
On the point of sale, what do you do for the lead? We made them put them against our master service.
They will do that if you're paying attention to it and you ask them to tag that on to your master service agreement. They will do it. And that's where you need to make sure that they apply the discount that they've guaranteed you in the master service agreement. It was done far enough back that I had no firepower, except for the rest of the time I told the organization, no more. We will not do point of sale service agreements. I used to sell them at Phillips. I used to make a bundle. Yep. Okay. Yet how much are you getting in discounts, and is it capital versus expense? Make sure you understand those issues. What is the most appropriate data needed to initiate this problem? All vendors hate or have service history. Ask them as a subset of equipment what their mean time between failure is on the device. That will tell you whether you're going to have to contract these devices quickly or you can wait. Okay. Typically, I don't like point of sale service agreements because I have no control. They're 2 years of warranty and 5 years of contract commitment. So if you have an in-house organization and you're doing point of sale service agreements, make sure there's a clause included in those point of sale service agreements for reduction for in-house service support if possible. Okay. Leverage other users' experience with POS. Go to your local people, because what one vendor is doing in an area can be different from what they're doing in another area. They can be better at it or worse. Okay. Do you have in-house support? We've talked about that. Can they be leveraged and trained? Yes. We have agreements with Siemens where we were smart enough to negotiate that we wanted to be able to have reductions at any point in time that we wanted them once we instigated training with Siemens or GE or Philips or whatever. Yeah. Well, that's an interesting question. Okay. There can be, and it can be agreed upon in a master service agreement about what your discount is going to be. Typically today with purchase groups like HPG and others, you don't have to worry about it with the VA. The VA gets the best service discounting in the country with the federal government, okay? And I won't repeat what their rate is. I know what it is. It's good. But typically somebody like HPG can get you anywhere from 30 to 40%, maybe a little bit more, because they leverage everybody across the spectrum that they're doing business with. That's what we missed out, was the large target offer. And when supply chain figured it out, they didn't realize what the loss was on the expense side compared to savings of capital dollars. That's what I talk about, capital versus expense. It's going to be dependent upon the number of systems that you have. Good luck. Okay. I wouldn't, if you would just have one unit and are only going to have one unit, I would not do a point of sale service agreement. You're not going to get anything on the service side back. Okay. Typically, point of sale is okay if you do not have in-house support and are a remote organization in a remote location, in my opinion. Okay. The reason why is if you're in Salt Lake City or you're in Los Angeles or whatever big metropolitan areas, they have so many service people there that it can drive service for you. You're going to get out of it what you need out of a regular service agreement. With point of sale, if I'm remote in Alaska, right, or Montana, somewhere to where those service reps have to travel a broad distance, okay, and try and service stuff, I'm okay with a point of sale because you can make at purchase better negotiating leverage because they want the point of sale service agreement. They make a lot of money off of those point of sale service agreements, okay? So they're willing to give a little bit in terms and conditions. Fleet management, cradle to grave. This is all about technology management, okay? Use your data and vendors to build future models for life cycle planning. What's life cycle planning mean? Huh? And a service. And we'll talk about some of this, okay? So the vendor should be able to supply all data such as operating system, software, hardware, revs, and EOSL status. End of service, folks, is when the vendor will no longer perform any services and they walk away from the device. Okay? Technology planning is important for service planning. Why? You can plan your budgets out, whether in-house managed or not. You can understand your futuristic cost and cost of ownership by understanding how much service is going to be. Okay? Build planning with key organization members, of course, that's your users. Establish replacement plans by modality based on when to replace. Folks, I do this for a living. And this is the biggest point I try to drive home. Every modality is different. I don't care if it's MR. MR's different from CT for planning, okay, from nuclear medicine or molecular imaging, what it's called today, okay, from cath labs. Their lives are different depending upon the organ or the vendor that you're buying them from. And I'm going to give you a case in point. We bought years ago Philips ultrasound system. We bought their Maximizer upgrade program as part of our service agreement with them to keep our ultrasound fleet on par across the system. We did that. It was a great thing, really good, because we were able to extend life out. And Philips told us that they were coming out with a new product and gave us EOS dates. Philips announced in March or December of last year that they were extending life on the Epic ultrasounds out to 2033 if you had Maximizer. We went from planning the replacement of all of our fleet to not replacing it, and the users are like, it's freaking 15 years old, I want to replace it. And we go, it's current technology. But one of them made something that made me think about that. They said, is every single part in that thing replaced? No. Be careful with upgrades. Understand what the upgrade is and whether it really gets you there or not. And I would recommend with ultrasound doing side-by-side analysis of the old product with the new product, see if your image quality is the same. Okay. And that's just from experience. Have established protocols for evaluating replacement. Use methods like Gantt charting and end-of-life data to assist. We have a team that does all of our end of life research for us. Okay, they put it into our CMS. I take that in downloads, and I have an Excel spreadsheet workbook system that I designed for the hospital for ranking everything. And on a quarterly basis, I do updates on that spreadsheet now because things change. Philips changed their end of life like 3 times in the last 5 years. They went one direction, went back, and then they went back again. I just was like, I went to some friends and I asked them why are they doing that, and they wouldn't answer my question. Finally, for Freeland to build capital replacement placement models that stage out equipment from the beginning of implementation in your facility to retirement. Here's the next step. When your supply chain management departments order equipment, they should be asking the vendor, I want a letter with the original letter from the FDA for this particular product group for 510K. Why? Because that's when the device was inceptualized. That's how old the fleet or the equipment population is. And you got to know when you have this product in its life cycle. Because if you're not doing upgrades, guess what? You're giving your equipment early graves. Understand the product's life lasts between 18 to 20 years. If you have continuous upgrades in your system, you can make your equipment live, folks. There's nothing wrong with that. Yeah. That's part, these types of upgrades are part of that. It's called an obsolescence management program. And almost all the vendors have them now. I helped Philips develop theirs 15 years ago. Okay. It actually was a request from my customer and a couple other larger customers that we had that they wanted to know not only when our products were conceptualized and going into life, but when everybody else's was. And that was a big task for us to do. If you have not, look out for early end of life and forklift upgrades. Okay, because if you don't do upgrades, the forklift upgrade, it's called a new piece of equipment. Okay, and you're not doing your organization any good by being in this domain. And then understand how obsolescence management works. All it is you're going to get 1 hardware upgrade and 2 software upgrades in a 5-year period. Okay, but those upgrades will help you manage your fleet, give you time to spread your equipment out a little bit and rank and stack that equipment to where it makes sense, to where it smooths the curves a little bit in your budgets. That's all it's about. And some make rights. Anybody understand what a make right is? What's a make right?
Well, perfect example, I had our mobile MR vendor who was not meeting the contract needs as defined in the contract. So we had a meeting to tell him we're going to violate him and cancel the contract, or he was going to make it right. So he added another person and another mobile MR at his own expense to make it right.
Right. And so I'll give you an example. When I was at Philips, we had a product that they bought, and in the purchase agreement, we specified guaranteed throughput. System never met throughput because the reconstruction computer wouldn't talk to the CT. They had that thing and they tracked the maintenance costs on it, and it cost them $4 million in 7 years to cover this equipment, and they tracked all the revenue that they missed out on. And it was like $22 million. They came to us and said, we want a new CT, PET CT. And Philips bought. Now, LA County is a government contractor. What kind of a clause do they put about debarment in federal contracts?
Well, in new purchase of new equipment.
No, in service agreements. They had a clause in the LA County contract that said if the county was unsatisfactory with our performance in any way, they could debar us from doing business for 5 years. Folks, we had $40 million of revenue a year with the county. It was a $200 million loss, and Phillips couldn't understand why they needed to replace the PET CT. I took it all the way to the top of Phillips, and I got my ass kicked for it. But I found my sales manager, and I found a vice president and said, why haven't we done this? And we did it. What? Let's see. All my promotion opportunities ended that day. Okay? Because I had my VP go, Dean, and I said, Brand, shut up. We're going to lose our business. Do you want to be responsible for the 200 million? And everybody was quiet. That's when the sales manager said, Dean, I think I found somebody. We had a conference call the next day, and he asked me on the conference call, this VP asked me, he goes, Mr. Skillicorn, I ask you a question. I said, yes, sir. He goes, 5 years. And I said, yep, 5 years. It's right here in this clause. And he goes, done. He says, you have my verbal authority to go tell the county that they're going to get their PSAT at no cost. They pay for construction. And it was done. But I got my ass kicked. I was never welcome for promotion. So I ended up leaving the company a year later. You have to go to battle for yourself, folks. Okay. The rest of this is on the slide decks. You all have access to the slide decks. Okay. You can get them. Please leave your remarks back here, or excuse me, on here. Okay. They want customer feedback on how well the presentation went. It went a little bit longer than I anticipated. I'm sorry that we did that. I hope you enjoyed the presentation. If you want to talk to me on private side, I'll be here for the next 10 to 15 minutes, okay? Thank you, everyone.